happens when an animal is, well, born different? We often think about birth defects in people, maybe our pets, right? But have you ever really stopped to consider what that means for animals like, say, llamas or alpacas, or even wild deer? How does nature handle it? And how do we... Today, we're taking a deep dive into this fascinating and, yeah, sometimes pretty heartbreaking world of congenital defects. We're focusing on two distinct groups. Camelidae, that's your camels, llamas, alpacas, and Cervidae, the deer family. Our mission here is to pull out the key insights from the research you've shared with us, really give you a shortcut to understanding these critical issues, and importantly, the huge differences in outcomes.
Yeah, we're going to explore what these defects actually are, where they come from, and crucially, how the survival and welfare side of things looks completely different for, say, a domestic llama versus a wild deer fawn. It's a journey into genetics, environment, and, well, the raw power of natural selection. Okay, let's get into it.
Okay, so to really get a handle on this, let's start with the basics. What exactly are congenital defects, and, how do they even happen?
Right. So congenital defects are basically abnormalities. Things you isn't right at birth. They can be structural, so a visible malformation you might see.
Okay.
Or they can be functional, impacting how an organ or a system actually works. These problems pop up because of errors during development in the embryo or fetus, and they can affect, well, pretty much any system. The skeleton, the heart, breathing, digestion, the nervous system, you name it.
Wow. Okay. So what causes these errors? Is it just bad luck or genetics or...
It causes the etiologies, as scientists call it. It's actually quite diverse. Genetics is definitely a big piece. Inherited mutations, problems with chromosomes. We see certain defects tend to run in families, especially in camelids, and a high degree of herd consanguinity that's basically inbreeding can really increase the risk there.
Right. Inbreeding makes sense.
But it's not just genetics. Environmental factors are huge, too. Things like the mother being exposed to toxins while pregnant or not getting the right nutrition, like lacking folic acid, copper, iodine, even infections during pregnancy like BVD virus, bovine viral diarrhea virus, can cause problems, or physical trauma. And then there's a third category, teratogenic factors. These are specific things like drugs, chemicals, even radiation that directly mess with normal fetal development.
So it sounds like it's rarely just one single thing, more like a complex mix of potential causes.
Exactly. It's often an interplay. And the impact, well, that varies massively too. Some defects are actually quite minor, maybe barely noticeable, compatible with a normal life, but unfortunately many are really severe. They can lead to what we call non-viable neonates, newborns that just cannot survive. Or if they do survive, they face a significantly compromised life.
Okay, this is where I found the research particularly striking. When you look at livestock, llamas and alpacas seem to stand out. They apparently have a really high rate of these defects compared to other animals.
They do, yeah. It's something breeders are very aware of. And when we talk camelids, we almost have to start with craniofacial defects, problems with the head and face, particularly one called Choanal Atresia, or CA. This is probably the most widespread and, frankly, feared defect in llamas and alpacas.
Choanal Atresia, what is that exactly?
It's a failure of the intranasal passage of the choana to open up properly during development.
Yeah.
So there's literally a physical barrier blocking airflow through the nose.
Okay. And why is that so critical?
Because camelids are obligate nasal breathers. That's the key. Unlike us, they can't just decide to breathe through their mouths if their nose is blocked. They have to breathe through their nose.
Wow. Okay, I see the problem.
Yeah. So if it's bilateral, both passages blocked, it's immediately life-threatening. Newborn crias, the babies, they show severe respiratory distress right away. Gasping, flaring nostrils. And tragically, when they try to nurse, they often inhale milk because they can't breathe and swallow properly. That leads to aspiration pneumonia, which is usually fatal.
Oh, that sounds awful. Can vets diagnose it easily? Is there treatment?
Diagnosis is relatively straightforward, yeah. Vets can try passing a small tube or check for condensation on a mirror held under the nostrils. But the prognosis is generally very poor. Surgical correction is technically possible, but it's risky, often unsuccessful, and many wouldn't recommend it. Euthanasia is often the most humane path.
And you mentioned genetics earlier. Is this thought to be inherited?
Strongly suspected, yes.
Yeah.
It seems to have a hereditary basis. Interestingly, it shares some features with a human condition called charge syndrome, which is linked to a specific gene, CHG7. So it points towards a definite genetic vulnerability, not just random chance.
Okay. What about other facial issues? I remember reading about something called Wry Face.
Ah, yes. Maxillofacial dysgenesis, or Wry Face, that's another significant one. It's a sideways deviation, a twisting of the upper jaw, maxilla, sometimes the lower jaw, too. It can be slight or it can be really severe, like bent more than 60 degrees.
60 degrees? That sounds extreme. What's the impact?
It's mainly functional. In severe cases, it can actually obstruct the nostrils, and it prevents the incisor teeth from meeting the dental pad properly. So nursing becomes impossible. Grazing later on is impossible. It sometimes occurs along with choanal atresia, actually. And again, prognosis for severe cases is poor. Euthanasia is often needed. And yes, it's also presumed to be genetic.
These craniofacial issues sound incredibly challenging, hitting basic survival functions like breathing and eating. Does this higher rate of defects in camelids extend to internal things too, like, say, heart problems?
It absolutely does, yeah. The most common congenital heart defect we see in llamas and alpacas is something called ventricular septal defect, or VSD.
VSD. Okay, what's that?
It's basically a hole in the wall, the septum, that separates the heart's two lower chambers, the ventricles.
And how serious is that?
It depends on the size of the hole. Small VSDs might just cause a heart murmur that a vet can hear. The animal might live a perfectly long, normal life. But large defects are a different story. They can lead to congestive heart failure, exercise intolerance. The cria gets tired very easily, failure to thrive, not growing properly, and sometimes even sudden death.
How do they find that?
Usually starts with the vet hearing a characteristic murmur, often loudest on the right side of the chest. Then they'd confirm it with an echocardiogram, an ultrasound of the heart. And it's not just the head and heart. Camelids seem prone to other systemic defects too.
Like what?
Well, in the musculoskeletal system, you see things like arthrogryposis that's contracted, stiff joints, angular limb deformities, crooked legs, polydactyly extra toes, syndactyly fused toes, gastrointestinal system, sometimes Atresia Ani, where the anus is absent, or Atresia coli, where part of the colon is missing.
Wow.
And the urogenital system seems particularly affected in camelids compared to other livestock. Things like uterus unicornis in females only one uterine horn, underdeveloped ovaries, sometimes even double cervices. In males, you see retained testicles, cryptorchidism, or underdeveloped testicular hypoplasia. Quite a range.
So, with this whole array of potential problems, how do vets typically figure out what's wrong and what are the options? It sounds like it runs the gamut from manageable to, well, not.
Exactly. Diagnosis usually starts with a really thorough clinical exam. Then, depending on what's suspected, imaging comes into play, x-rays, ultrasound, sometimes even MRI. If a genetic link is suspected and tests are available, they might do genetic testing.
And management.
It really hinges on the specific defect and how severe it is. Supportive care can help some animals. Surgical correction might be an option for certain things, if the condition is amenable to it and the prognosis is fair. But yeah, for the really severe defects, especially those that drastically impact quality of life right from the start, humane euthanasia is often the kindest and most responsible decision.
Which leads to prevention, I guess. For breeders managing these animals, given that some of these issues are clearly hereditary, is there a big focus on trying to prevent them?
Oh, absolutely. Prevention is critical in camelids precisely because they are managed by humans. It involves really diligent genetic counseling, avoiding breeding animals known to have produced defects or animals that have defects themselves, even if mild, making sure the mothers have excellent nutrition during pregnancy, and increasingly using routine genetic screening within breeding programs to try and weed out known problematic genes. It's all about responsible breeding.
Okay, so we see how human choices, human intervention really shape the story for camelids born with defects. But now let's shift gears completely. Let's go into the wild. Let's talk about deer. Why is finding and understanding these same kinds of defects so much harder out there? It seems like a totally different ballgame.
It is fundamentally different, yeah. The simple reason is that documentation is just incredibly sparse in wild populations. And the core reason for that, natural selection. It acts incredibly swiftly and, frankly, ruthlessly in the wild. A fawn born with a significant problem is just highly unlikely to survive long enough for anyone to find it or study it.
So where does our knowledge come from then?
Most of it comes from animals harvested by hunters, which might show older, less severe defects, or from captive deer populations where animals are observed closely, or, sadly, from finding fawns that died very soon after birth, which sometimes allows for examination.
Right. Now, one condition in deer that is sometimes seen and is quite striking visually is piebaldism. What exactly is going on there, and what does it signal?
Yeah, piebaldism is visually striking. It's a genetic condition. It's recessive, meaning both parents have to carry the gene. It gives the deer that sort of patchy pinto look, irregular white and brown patches.
Okay, so it affects coat color?
It does, but here's the really fascinating part, the key insight. It often exhibits pleiotropy. That's a scientific term meaning the gene responsible for the coat color also controls other developmental processes.
Ah, so it's not just skin deep?
Not at all. Piebald deer very frequently have other problems, often skeletal deformities. Things like an arched spine scoliosis, short or crooked legs, a bowed nose, sometimes called a Roman nose, short lower jaws, malformed hooves. And internal organ defects are pretty common too.
Wow. So that pinto look can be a sign of much deeper issues. What does that mean for their survival?
It varies. If the piebaldism is mild and there aren't severe associated defects, they might live a relatively normal life, although that white fur doesn't help with camouflage.
Right, predators.
Exactly. But if the deer has severe deformities, especially skeletal ones, the chance of survival is very, very poor. Fawns born with major issues often die within hours or days. They just can't function properly. And that conspicuous coloration definitely makes them easier targets for predators, compounding the problem.
That link between the coat color gene and other developmental problems is really interesting. Are there other skeletal or facial issues seen in deer, maybe ones not linked to piebaldism, that tell us something about the health of the population? Maybe hints about inbreeding?
That's a great angle, yes. Besides piebaldism, other skeletal defects have been reported. Things like osteopetrosis, which makes bones brittle, and arthrogryposis. The joint contractures we mentioned in camelids have been seen in white-tailed deer. But what's potentially really insightful is the occurrence of cervical ribs. These are extra little ribs that can form on the seventh neck vertebra.
Extra ribs on the neck.
Yeah. And some research suggests that finding these might be an indicator of reduced genetic health or potentially higher levels of inbreeding within a population. For instance, studies looked at the extinct Irish giant deer and also the pair David's deer, which is known to be highly inbred. Both showed a really high frequency of these cervical ribs. It's like a possible little red flag for genetic diversity issues.
Interesting.
As for other facial issues, wry face, like in camelids, has been documented, but it seems extremely rare in deer. Cleft palate has also been seen occasionally. And you can get other defects, though they seem less common. Ocular things like microphthalmia, abnormally small eyes, anophthalmia, no eyes at all, congenital cataracts, cardiac defects, heart problems are generally thought to be quite rare in wild deer populations. But again, they can occur, ranging from mild to lethal, just like in other animals.
So, given how hard it is to even spot these issues in the wild, diagnosis and management must primarily happen in captive situations, right? How does that work? And what about prevention?
Exactly. For deer in captivity or highly managed settings, diagnosis follows similar lines: clinical exam, imaging, maybe some selective genetic testing if it's available and warranted. Treatment options are also similar: supportive care if possible, surgery for things that can be corrected, or euthanasia if the quality of life is severely compromised.
And prevention.
In those managed populations, prevention focuses on genetic screening through selective breeding, trying not to breed animals known to carry problematic genes, and good environmental management is important too, making sure pregnant does have proper nutrition and aren't exposed to potential teratogens, those harmful substances.
Okay, so we've looked closely at camelids, looked closely at deer. It seems overwhelmingly clear that the environment, domestic versus wild, is the defining factor in what happens to an animal born with a defect. Can you sort of crystallize that contrast for us?
Yeah, it's perhaps the most stark contrast you could imagine. For camelids, living in a domestic setting, survival hinges almost entirely on human decisions, human intervention. If a cria is born with something severe and untreatable, like that bilateral choanal atresia or really bad wry face, humane euthanasia is the standard practice. It prevents prolonged suffering.
Right.
For less severe problems, treatment might be an option. But the critical point for breeders, the advice they're strongly given, is to remove affected animals and their parents from the breeding pool. Stop the genes from being passed on. It's about responsible management.
Okay, that's the domestic side. What about the wild deer?
In the wild, there's essentially zero human intervention regarding these defects. Natural selection is the only judge. It's completely unforgiving. A fawn born with a significant defect is, as one study put it so vividly, born with one hoof in the grave. Think about it. It might struggle to nurse effectively. It'll be slower, less able to escape a predator, less able to cope with bad weather or find food. Research actually shows that a high percentage of fawn mortality is due to natural causes, often listed as things like birth defects or just general weakness, emaciation. This happens even before you factor in predators,
Ooh.
which suggests that predators might often be taking out what's sometimes called the doomed surplus individuals that likely wouldn't have survived long anyway due to these underlying
How if
issues.
nature cleans house, essentially?
Precisely. It's this intense selective pressure that explains why you so rarely see adult wild deer with severe congenital defects. They simply don't make it that far. It's a tough process, but it's fundamental to maintaining the overall fitness and resilience of the wild population.
Taking a step back then, what's the bigger picture here? What do these studies of defects in these two very different groups tell us overall?
Well, they offer really critical insights, I think. For domestic animals like camelids, it really underscores the need for very careful genetic management, for responsible breeding practices. It highlights our role and responsibility in maintaining the health of the animals under our care. For wild animals like deer, it's a powerful, almost visceral demonstration of natural selection in action. It shows its relentless efficiency, its essential role in shaping species, and ensuring only the fittest survive and reproduce, weeding out vulnerabilities over generations.
So, as you've been listening, what really stands out to you? I mean, think about that massive difference in outcome. An animal born with a defect on a farm versus one born in the deep woods. It really makes you wonder, doesn't it? Our growing ability to intervene, to treat, to manage these conditions in domestic animals. What does that tell us about how our relationship with the animal kingdom is changing? And how does that human influence stack up against the raw, unyielding forces of nature that shape life in the wild? Definitely something to think about.